name's Allie. I'm going to be putting in a foley catheter for you today. Can I have you confirm your name and date of birth for me?
Brody Pass, October 10th, 1983.
All right. I'm going to go ahead and put on the gloves and raise your bed. Just so you know, this procedure is going to be a bit uncomfortable, but I'm going to do it as fast as I can to make it more comfortable for you. Is that all right with you?
Yes.
All right. And then are you allergic to latex or iodine?
No.
All right, perfect. So I'm going to go ahead and get my gloves on. We're just going to first start out by cleaning the penis and the surrounding area. Make sure that we keep it all clean. Go ahead and get my water and towels. Yes, I do. I'm going to put this pad under you. Just keep your bed all nice and dry. Does that feel okay?
Yes.
All right.
Yeah, okay.
All right. Now we're just going to go ahead and dry you. All right. So now I'm going to go ahead and set up my sterile field. Open. Go ahead and get these drapes. First is this one. Go ahead and put this under you. Keep your area all nice and dry and clean. Alright, and also this one. And then today I'm not going to be using the fenestrated drape just to keep you a little bit more comfortable and to make cleanup a little bit easier. Put that down there. Get my supplies out and ready, keeping it all on the sterile field. I'm going to remove the cap for my catheter. Put that in. Go ahead and spread my iodine solution. Fluff my cotton balls. All right. Going to put the iodine solution on there. Then I'm also going to get my lube ready. So now I'm going to go ahead and just clean the penis. So now that it's all clean, we are going to go ahead and get started. And then would you like to use any anesthetics today?
No, I'm okay.
All right, so if I were gonna use some, I would insert that now and let it sit for 5 to 10 minutes to take effect. since you opted not to, we're going to go ahead and start with the catheter insertion. Going to go ahead and loop this up about 5 to 7 inches. I'm going to go ahead and remove this. All right, and then while I do this, I'm going to ask you to bear down as if you were trying to void. And then now that I have inserted, please take deep breaths for me. You're doing excellent. All right, now that urine flow has started, I'm gonna go ahead and insert it another 1 to 2 inches. All right, I'm gonna go ahead and inflate the balloon. All right. Now that the balloon is inflated, I'm going to tug, and I meet resistance, which means it's in properly. So now I'm going to go ahead and clean up my area. Now I'm going to put gloves on. We are going to attach this to you and to your bed to make sure it stays out of your way. Are you feeling okay?
Yes.
All right. You cleared your storage, right? Yeah. Going to attach this to the side of your bed. Now we're going to go ahead and attach it to your leg as well. Excellent. Go ahead and put this too. Move your leg a little bit. This two here. All right. Does that feel okay? Not too tight?
Oh, yeah, that's good.
All right. I'm gonna go ahead and remove these pads out from under you, and we will remove it as soon as possible. Go ahead and fix that. There you are. Get you covered back up. All right. Now that it's a couple days later, we're good to remove your catheter. So the first thing I'm going to do is perform hand hygiene, and then also get new gloves on. How are you feeling today, Mr. Pass?
Pretty good. How about you?
Excellent, thank you. So before I remove it, I'm going to go ahead and empty the catheter, and I'm going to be making sure to assess for amount, color, and odor to make sure that your kidneys are working properly and that you're properly hydrated. Stained gloves. All right. I'm going to go ahead and put this pad under the catheter. I'm going to use the urinal to empty it. All right. Now I'm going to go ahead and all right, now that the catheter is empty, I'm going to assess it, and then I'm going to dispose of the urine according to hospital policy. So now that we've gone ahead and done that, we're going to remove the catheter. All right, let's move the blankets out of the way. And this. I'm going to grab the bed. Also going to put this waterproof pad under you. Keep your bed clean and dry. I'm going to remove it from the leg strap. letting gravity do the work. I'm not going to pull the syringe at all. All right, now that it is filled and the balloon is empty, I'm going to go ahead and ask you to take deep breaths. I'm going to remove this as quickly as possible. 3, 2, 1. Excellent. Did a great job today, Mr. Pass. Let me know if you are feeling any uncomfortableness or have any issues you want to talk about.
Thank
Do you
you.
need assistance with perineal care at all?
I think I can do it.
All right. I'm gonna go ahead and lower your bed. And all your possessions are on the bed next to you. The collar is in place. The wheels are locked. And the bed is lowered in the lowest position. Have a wonderful day.
You too.
Thank you.